Here comes the sun, and quarantined Canadians are heading outdoors in record numbers to soak up all they can. Joining me now is Dr. Julia Carroll, a board-certified dermatologist known for her designer approach to beauty. She is the best-kept secret for many Canadians who love her personalized, natural results. Dr. Carroll travels worldwide, both lecturing and learning to bring the latest results-oriented treatments to her patients. Apart from her busy dermatology practice, she also holds a teaching position at the University of Toronto. Welcome to the show, Dr. Carroll.
Hello. Well, that was clearly written pre-COVID when I used to travel the world.
Nobody's traveling right now. So you're seeing all these people heading out in the sun, and what's your number one piece of advice?
Well, wear sunscreen. It's the easiest way to prevent sunburns and the easiest way to prevent cancer.
So, we were talking a little bit before this segment, and I'd said to you, there's science is sort of coming out saying that vitamin D is good for you in fighting COVID, to get outside and get a little bit of it. How do we reconcile those two sort of messages right now and keeping our skin safe and our health strong?
Well, it's a really good question because I think we get a lot of conflicting information from the news and from certain presidential, leaders. But what I always tell patients, whether it's vitamin D for COVID or vitamin D for bone health or other conditions, is if vitamin D is really important to you and you want to make sure you get enough that's going to help you, then you need to take it in a pill supplement. I take a gummy of vitamin D every day because I would like to get vitamin D, but I'm not prepared to give up skin health for that vitamin D. So that's what I suggest.
Well, I have to tell you, I was about 2 weeks into this pandemic, and I was diagnosed with a little precancerous spot on my nose, and I had to do topical chemotherapy, Efudex.
Efudex.
Left a nice little, hole in the side of my nose there and scab. I had to do videos with it for a few weeks. So I do not want to go back to that. That's absolutely.
Yeah, and I think that people too, they use this, I'm getting my vitamin D as an excuse to get sun because it's sort of, but people can't argue with it. But for me, it's an excuse.
So what would you say of people who say sunscreen isn't safe? The products the chemicals or the things that are in sunscreens are not safe?
Well, I think we have lots of evidence that the products that are in sunscreens are safe. There's two categories. There's physical blockers and there's chemical blockers. And a lot of the evidence gets really mixed up in some fear-mongering, clickbaity kind of stuff that's out there. If you actually delve into it and you can read the papers, the safety is there. The ones that aren't safe, they get pulled off the market. And that hasn't happened for a long time. But the other thing is, so if you don't like the chemical sunscreens, then you can use physical blockers, which are titanium and zinc. And if you really don't want to use a sunscreen, that's just one of three things you can do. You can also protect yourself with hats and sun protective clothing, and you just stay out of the sun during the peak hours. So, for me, it's about getting protection from the sun any way you can.
Okay. So let's say there is sun damage. What can we do to reverse the effects of that?
So there's a number of things you can do. Skincare is really important. So, wearing sunscreen daily so that you're not getting further damage. Products with antioxidants like L-ascorbic acid, which is a type of vitamin C, is helpful for reducing some of that sun damage. But if you really want to see, quick results, lasers are fantastic. So they get rid of brown spots, red spots, they can resurface some of the fine lines. So in my practice, we do a lot of laser.
And is there a lot of downtime involved with laser, like where your skin is inflamed or sore?
It really depends. Some of the lasers are no downtime lasers. We call them lunchtime procedures. And so those ones you tend to do that. You need a number of procedures, repeatedly to get results. And some of my patients, that's what they want. Other people say, you know what, I'm busy. I just want to hit me hard. I'm going to take the next week off and I don't want to see you again for a year. And we have those as well. So it's a combination. We can tailor it.
Okay. So when it comes to our children, you say that we need to be a model for them. So what does that look like?
So I think that it just as you would wear a helmet when you're riding a bike, and if you would put your seatbelt on when you get in the car, I think our kids need to see us wearing sunscreen and making it part of our daily habit, so that they just see that as a normal thing you do before you go outside to ride your bike or to go to the beach. And then I always get the kids involved. Like I have a 10-year-old daughter, and I use stick sunscreens. I let her do her face, and I'll go back and touch it up. But she likes to feel, she doesn't want to be attacked with the sunscreen. She wants to feel that, she's part of the process and she has autonomy.
So I don't want to put you on the spot here, but I'm curious, do you have any sort of favorite products that you return to again and again?
Yeah, so we have a few sensitivities and allergies in my family. So the brands that we tend to use, I like ones that are quick and easy to get at drugstore. So for the family, I use a lot of La Roche-Posay and Telios, and I like Neutrogena. When I'm being a little bit more fancier for my face, I use Lumiere MD sunscreens. There's some Vivier products that I like. And then SkinCeuticals also has a really nice variety of sunscreens. So, I mean,
I was just going to say, I have a SkinCeuticals one for my face right now that I'm loving because it actually has like a foundation in it as well.
It's tinted. Yeah.
Yeah.
Yeah. Because I don't have time for all these things. So I like anything I can do that's 2-in-1, I'm in.
Exactly. So it's great. So if people want to get in touch with you, how can they do that best?
Oh, so they can follow me on Instagram, which is at Dr. Julia Carroll. We do lots of fun videos, and it's very informative and interactive. And then my office is compassdermatology.ca.
And where are you located?
We're in Midtown Toronto, so Mount Pleasant, just south of Eglinton.
Okay, wonderful. Thank you so much for joining me today.
It was my pleasure.